Hi everyone, my name is Jordan and today I'm going to be presenting my loose parts electroencephalogram. So an electroencephalogram is also abbreviated to EEG, which is what I will be using to refer to it today. So an EEG is a test that detects abnormalities in your brainwaves or in the electrical activity of your brain. During the procedure, electrodes consisting of small metal discs with thin wires are placed onto your scalp, and the electrodes detect tiny electrical charges that result from the activity of your brain cells. So here I have an EEG connection board, I guess you could say, and these tiny pieces of tape at the end of these strings represent what is happening. So before the procedure, typically you should not eat or drink anything with caffeine in it for 12 hours before the test. And you should shampoo your hair and rinse with clear water the evening before or the morning of the test. You should not put any hair conditioner or oil after you wash your hair. So typically in an EEG, 64 or more electrodes are used. However, in practical applications, fewer electrodes are required. So today I brought my old friend Julie, and Julie is going to be having an EEG today. And so we are going to explain how this process kind of works and show you kind of what happens. So the EEG electrician will begin by marking the patient's head with a washable marker so they know where to place the electrodes. So typically that would be here and here and some places along the back of your head. They will then place the electrodes with some sticky salt paste. So we are going to take this connection board and place these electrodes. We're going to try and place these electrodes on Julie's head. Just a couple. Typically, it would be the whole thing. But it would be all of them placed all over her head. And we use a sticky salt paste because salt is conductive, which means it will help in reading the electrical currents that is going on in your head. So salt is conductive, and because it's a sticky paste, it will help stick the electrodes to the scalp, which obviously I am lacking here. They will then cover the head with a gauze to help the electrodes not fall off. So I'm going to wrap Julie's head, typically not her face, but just her head, in this purple gauze. And there will be 3 series of tests. One will be with a flashing light, a deep breathing activity, and obviously sleep. And all of these are to see how your brain will respond. So electrodes are small metal discs, which are represented by these pieces of tape at the end of these strings. And so there are small metal discs with thin wires that are placed onto your scalp. There are a couple different types of EEGs. One type might feel like a hat is being placed on your head because all of them are connected. But for the most part, they are placed individually. This is a painless procedure, so no needles or pain whatsoever are involved. You should not hear anything during testing except for maybe a faint beeping from the machines and the technician's instructions. You should not smell or taste anything either. The child's job during the procedure will be to lay still and relax, as Julie is doing here. You must lay on your back, being still and relaxed while the electrodes are being placed on your head. You must also have to have a little patience and cooperation. So, if you are moving or flailing around, obviously the electrodes are not going to stick to your head. And if you move after they're placed on your head, you will not get an accurate reading. So putting all of these small discs on the patient's head will take about 20 minutes, and the procedure itself will take up to 40 minutes. After the electrodes are placed on, and as long as they do not fall off, patients will be allowed to sit on the parent or guardian's lap if under the age of 4. You must lay on your back and be really still and relaxed so that the recording is clean and the doctor will be able to read it. That is all I have. Thank you for watching this, and thank you to Julie for being a paid actor. I will see you guys later. Bye!